Have you ever pondered the severity of a bacterial infection in the most sensitive regions of the body? One such infection is Fournier's gangrene, a rare and potentially life-threatening condition that affects the genital and perineal regions. This infection was first described in 1883 by the French venereologist Jean-Alfred Fournier, hence its name. It's characterized by the rapid spread of bacteria, often originating from an infection in the urogenital or anorectal area, leading to necrosis or the death of surrounding tissues. The most common culprits include a mix of aerobic and anaerobic organisms, such as Escherichia coli, Streptococcus, Staphylococcus, and Bacteroid species. The swift progression of this infection can cause severe pain, swelling, and tissue necrosis, often accompanied by systemic symptoms like fever, chills, and malaise. Therefore, Fournier's gangrene is not just a common bacterial infection, but a medical emergency that requires immediate attention. So, what exactly triggers Fournier's gangrene? Well, it's a complex interplay of bacteria, typically originating from an infection in the urogenital or anorectal area. The most common culprits are mixed aerobic and anaerobic organisms. These include the likes of Escherichia coli, Streptococcus, Staphylococcus, and Bacteroid species. These bacteria, once they gain entry into the body, can spread rapidly, leading to the death of the surrounding tissues. This process is known as necrosis, the phenomenon that gives Fournier's gangrene its terrifying reputation. Now you might be wondering, how do these bacteria get in there in the first place? Well, they usually enter through a tiny cut or abrasion, often unnoticed by the individual. From there, the bacteria can gain access to the deeper tissues and start to multiply, causing the infection to spread. But it's not just about the bacteria. Certain individuals are more susceptible to developing Fournier's gangrene. This includes those with compromised immune systems, who may have a harder time fighting off infections. People with diabetes are also at a higher risk, as high blood sugar levels can impair the body's ability to combat infections. Other underlying health conditions such as kidney disease or obesity can also predispose an individual to this severe infection. It's important to understand that these factors don't guarantee the development of Fournier's gangrene, but they can increase the risk. The body's ability to fight off infection is a complex process, and a multitude of factors can influence its success. Despite the disturbing image this condition paints, remember that it is relatively rare. Our bodies are remarkably resilient, and with the right care and attention, we can keep them in good shape to fight off infections like Fournier's gangrene. So let's dive into how we can recognize the symptoms of this condition in our next scene and what we can do to treat it. Early detection can be life-saving, but how do we recognize Fournier's gangrene? Let's delve into the symptoms of Fournier's gangrene, a condition that doesn't hold back when it comes to manifesting its presence. It's crucial to keep in mind that these symptoms are not subtle whispers, but rather loud cries for attention. Firstly, severe pain is usually the initial alarm bell. This can occur in the genital or perineal region, often intense and rapidly increasing. The pain might be disproportionate to the physical findings initially. It's a severe discomfort that can't be ignored and warrants immediate medical consultation. Next up, swelling. The affected area often becomes swollen and red, sometimes accompanied by a foul-smelling discharge. As the infection progresses, the skin may darken and blisters may form, filled with gas produced by the bacteria. This process, called tissue necrosis, is a clear indication of the bacteria's destructive path and the urgency for medical intervention. Systemic symptoms like fever and chills often set in as the infection spreads. These are signs that your body is putting up a fight against the invading bacteria. You might also experience fatigue, nausea, and a general feeling of being unwell, termed as malaise. Now, this might sound alarming, and rightfully so. Fournier's gangrene is a condition that demands immediate attention. It doesn't lend itself to a wait-and-see approach. The rapid progression of the infection and its potential to spread to other parts of the body make it a medical emergency. Remember, these symptoms are your body's distress signals. They are an urgent call to action, a plea for help. Your body is telling you that something is seriously wrong and it's time to seek medical help. So, if you or someone you know experiences any combination of these symptoms, don't delay. Seek immediate medical attention. The sooner the diagnosis, the better the chances of successful treatment and recovery. Never disregard these symptoms. They are your body's distress signals. Now that we can recognize the symptoms, what can be done to treat Fournier's gangrene? Treating Fournier's gangrene is a critical process that involves swift and decisive action. The primary goal is to control the infection and stop its spread, as well as to manage the patient's systemic condition. The first line of defense in treating Fournier's gangrene is the use of broad-spectrum antibiotics. These drugs are designed to target a wide range of bacteria, including the most common culprits behind this condition such as Escherichia coli, Streptococcus, Staphylococcus, and Bacteroid species. The antibiotics are typically administered intravenously to ensure they reach the infected tissues as quickly as possible. They work by either killing the bacteria outright or by inhibiting their growth, thus helping to halt the progression of the disease. But antibiotics alone are not sufficient to treat Fournier's gangrene. This is because the infection rapidly causes tissue death, leading to the formation of necrotic or dead tissue. This necrotic tissue must be removed through a process known as surgical debridement. Surgical debridement is a procedure that involves removing the dead and infected tissue to help promote healing. It's a critical part of the treatment as it physically stops the spread of the infection. In severe cases, multiple debridement procedures may be necessary to completely remove all the necrotic tissue. While the idea of surgery might sound intimidating, it's important to remember that this is a life-saving procedure. Without it, the infection could continue to spread, ultimately leading to serious complications or even death. In addition to antibiotics and surgical debridement, supportive measures are crucial in the treatment of Fournier's gangrene. This might include intravenous fluids to prevent dehydration and maintain blood pressure, as well as other intensive care measures. These supportive treatments help to manage the patient's overall condition and can be particularly important if the patient has other underlying health conditions. For example, individuals with diabetes often require careful blood sugar management, while those with compromised immune systems may need additional supportive care. In some cases, reconstructive surgery may be considered once the infection is under control and the patient's condition has stabilized. This can help to repair the damaged area and improve the patient's quality of life. To sum up, treating Fournier's gangrene involves a multifaceted approach that includes the use of broad-spectrum antibiotics to control the infection, surgical debridement to remove necrotic tissue, and supportive measures to manage the patient's overall condition. While the treatment may sound intimidating, remember that it's crucial to prevent the spread of the infection and reduce mortality. Remember, time is of the essence when dealing with Fournier's gangrene, and prompt treatment can make all the difference. Let's recap what we've learned about this grave condition. Fournier's gangrene, named after French venereologist Jean-Alfred Fournier, is a rare yet potentially lethal bacterial infection that targets the genital and perineal regions. It's characterized by a swift spread of bacteria, typically originating from an infection in the urogenital or anorectal area, leading to the death of surrounding tissues. The most common culprits behind this infection include a mix of aerobic and anaerobic organisms such as Escherichia coli, Streptococcus, Staphylococcus, and Bacteroid species. Once the infection sets in, it can progress rapidly, causing severe pain, swelling, and tissue necrosis. Systemic symptoms like fever, chills, and a general feeling of being unwell may also accompany these physical changes. Immediate medical attention and surgical intervention are vital to halt the spread of the infection and reduce the risk of mortality. Treatment often involves a cocktail of broad-spectrum antibiotics to target the bacteria and surgical debridement to remove the necrotic tissue. Some cases may necessitate multiple surgical procedures, and supportive measures like intravenous fluids and intensive care may also be required. Fournier's gangrene is more prevalent in individuals with compromised immune systems, diabetes, or other health conditions that make them susceptible to severe infections. But remember, this is a rare condition, and maintaining good personal hygiene, effectively managing underlying health conditions, and seeking prompt medical attention for infections in the genital and perineal areas can significantly reduce the risk of developing Fournier's gangrene. The key to dealing with Fournier's gangrene is early detection, immediate intervention, and consistent preventive measures. Stay informed, stay vigilant, and always prioritize your health.